What if the system you trust to heal you is actually working against you? Bias in healthcare happens at multiple levels, from algorithms that make decisions based on biased data to doctors' assumptions about pain levels. Healthcare inequality continues to affect millions, especially people of color. Take predictive models used for case management. When they're trained on cost data instead of health data, Black patients are often under-identified for care, even though they need it most. It's a blind spot in healthcare that needs to be addressed. Pulse oximeters, devices that measure oxygen levels, can give inaccurate readings for Black patients. This can lead to delays in oxygen therapy and even dangerous outcomes, especially during respiratory illness or COVID-19. For decades, clinical equations for kidney function and lung health used race-based adjustments. These formulas affected diagnosis and treatment. But now, new race-free guidelines are changing the game, offering fairer, more accurate results for all patients. Black women in the US are 3 to 4 times more likely to die from pregnancy-related complications. This isn't just about healthcare, it's about systemic racism and the lack of support for Black mothers. Studies show that Black patients often receive less pain relief compared to their white counterparts. Outdated beliefs about race and biology lead to undertreatment, leaving people to suffer in silence. The good news, we can fix this. By auditing our tools, diversifying clinical trials, standardizing decision-making, and removing race-based adjustments, we can create a more equal healthcare system for everyone. Join the movement. Fight for equality in healthcare. Share this video, spread the word, and let's create a better future for everyone. Remember, health equity is not just a right, it's a responsibility. Stay informed, stay engaged.